welcome the opportunity to contribute to the debate, to thank Deputy McGrath for his mention there in relation to mental health and where it's come from since 2006. And as Deputy McGrath has quite rightly outlined, that it was only maybe a handful of people that spoke about this issue at the time, and we see a lot more across the political divide now being elected speaking on this issue, and I very much welcome that. Look, nobody's saying that the services are perfect or that there's a lot of work left to be done. The mental health sector was a Cinderella of the health services over a number of years, but we're seeing more and more of a political light to be shone upon it over the last number of years, particularly with this Dáil, with the election of TDs across the House from different parties, all parties and none, with a specific interest in this area. And this has culminated, obviously, in the production of a report that was done by the Mental Health Committee, the Interim Mental Health Committee, or Future of Mental Health Care Committee, a joint Oireachtas committee recently, a number of months back, which was obviously, I know Deputy Brown was the proposer of that committee, along with the support of the government, put that committee together. And quite a robust report was put together along with other party members. I see other party members here who were on that committee. Quite a robust report was put together in relation to highlighting some of the issues that are involved under the nuts and bolts of the mental health service. I'm here today calling for that committee again to be made permanent. I'm seeking an update from the government in relation to where we're at with the establishment of that committee. Minister Daly has and understands that I am pushing this very hard from behind the scenes, and would like to see that, because I don't want us to take our foot off the gas. What we saw there in relation to Vision for Change is that we actually started to investigate and shine a light upon was the actual implementation of Vision for Change, not only from a political point of view, but also from a management point of view or management structure point of view, to have that oversight or have that overlook for us as politicians to understand the intricacies of what is happening in the mental health services in order to be able to solve it. Very easy to stand up here and make big sweeping political statements and big sweeping headlines without actually understanding the nuts and bolts of what's going on behind the scenes. And I think it's incumbent on all of us to educate ourselves as much as possible, particularly with an issue like this that is extremely sensitive, and we have to watch our language each time we speak about it. So again, I'm calling on the government, along with support from all the parties, to have this mental health committee put permanently into place. And I think it sends out a message, it sends out a voice from the Oireachtas that we are taking extremely seriously this issue and putting it on the map. Just in relation to CAMS in the CHO3 area of the Limerick, North Tipperary, Clare area, there has been a reduction in the number of people on the waiting list in CAMS from looking here at the figures right up to October 18. There has been a reduction, I think, of roughly about 45 people on that. It has had its challenges. I think the major challenges with CAMS is obviously the global competition for consultant psychiatrists, and that's something we're going to have to try and solve. From the outset, obviously, as was mentioned earlier on, there is industrial dispute going on in relation to nurses and PNA as well. We had the PNA Association in with our committee, and we heard from them as well. I'd just like to put on the record that I would like to see a solution to the industrial dispute that's going on at the moment within the pay agreement. I would very much welcome that, and I think all sides need to continue to work to try and find a solution in relation to that, from my own opinion. There has been, developments in this across the House. We see in the education sector we've had the 300 hours of wellbeing be brought into primary schools. I think now we need to start thinking outside of the mental health block and thinking outside the health block, and we need to start thinking across departments. I know of companies out there that are actually bringing mental health and wellbeing into organisations and private-run companies as well, to stem off stress, which is happening in the workplace. And obviously there's a commercial kickback and people actually miss less days and are more productive at work. That's starting to happen on the ground. I want to see that. So I would like to see more of a cross-departmental approach to mental health right across the departments. That's citing one look at it. But if we do more research and more collaboration on that, which could be done through a mental health committee, I think that has a knock-on effect. We speak about early intervention here all the time. They're the types of early intervention, helping people, educating people, showing them how we can put these patterns of resilience into place to actually help them through either sports, through the arts or through their employment, which is something that people spend most of their week at, is their employment, and also to help people who are obviously, as they say, fall between the cracks or in a vulnerable situation, to be able to help those. We have the likes of Jigsaw, which is very good in relation to youth mental health. We have the National Suicide Prevention Office. I just want to put on the record as well some of the statistics in relation to Limerick City. There's some headlines going around in relation to Limerick City. The latest stats I have is that from 2013 to 2015, The Limerick city suicide rate was 21.8 per 100,000. It's now, at the moment, from the latest figures 2014 to 2016, is 15.4 per 100,000. I want to recognise the voluntary groups that work in this area in Limerick City that do a lot of work in relation to working with the public and intervention on the bridges, etc. there as well. I think that can't be gone unnoticed, and credit where credit's due on that. This is a collaborative approach. We need to work on this together. We need to be mindful of what we say, that we do not send a message out there. I understand opposition parties calling and highlighting where they see problems within the service, but I do not want to send a message out to the public that they are unable to interact with the service or not to come to the service. I still implore them to come to the service if they're in a crisis situation. I implore them to come to their TDs, their friends, their family, whoever it is, to get and engage with the service if they're in a situation that they require that help. And we have to be very mindful of that. Finally, Councillor, I know I'm over my time. I'd like to thank you as well for driving the mindfulness and mental health within the Oireachtas as well. I think we need to start, charity begins at home, or whatever way we want to say it, but we need to start preaching to ourselves in relation to it, and we need to practice it ourselves to be able to send that message out as well.
Thank you, Deputy.